Thanks a lot. Just a few days left in Medicare's annual election period as the December 7th deadline is fast approaching. Picking the plan that's right for you can be a bit confusing, and to help answer some questions, we're joined by Dr. Michael Sayasambat of P3 Medical Group, otherwise known as Dr. S.
Yes.
Thank you for being here today.
Thank you for having me.
It is a good time, and we only have a short time left for those who enrolled in Medicare or those who are going to enroll in Medicare to do so. Why is it so important to do this now as opposed to when someone is feeling sick?
Well, I'm a firm believer in Murphy's Law, especially when it comes to medicine. When things are going great, you don't think about it. But all it takes is one bad event, one fall, one heart attack, one stroke, and everything goes out the window, especially in these financial times where everybody's scraping to make every dollar count. Yeah,
and there are things to consider because some of the Advantage plans include dental and vision, so those are things to think through as you go through this process.
Yes, those are specifically related to what they call Medicare Advantage plans. Some of these Medicare Advantage plans also have travel benefits. For instance, you get roughly 12 round trips to your doctor's appointments every year. Some also provide groceries. If, heaven forbid, you go to the hospital, they can provide groceries for about a week or two, I think roughly after you get out, till you get back on your feet.
Yeah, those are the plans that really benefit those who sign up when those hard times hit. A lot of people sign up when they're 65 and they may go with the traditional A or B plan. But each year you do want to assess where you are in your health progression, right?
Yes, definitely. What I tell patients is this: when you retire, you're 65, you've been working, you're still relatively healthy, a lot like to travel around the country through the RV. But as you get older, the medications, the bills add up, your conditions worsen. It might be time to consider changing your insurance at that point, something that might give you more benefits.
Yeah, so you're suggesting people sit down with a broker and really talk through things because there are so many factors to consider, right?
Definitely. Insurance is complicated. Nobody can keep up with it all. Even brokers, I mean, this is all they do 24/7. So you definitely need a professional to help walk you through it. Looking online is good. Do your homework, but definitely you want to consult a professional before you make that final decision.
Even as doctors, it has to be difficult keeping up with all the changes, not only in Medicare, but with insurance in general. It seems the evolution seems to be continuing and even quickening.
Oh, let me tell you, one day is different from another. What medication was covered today is not covered tomorrow. What specialist you can send somebody to today is not the same specialist you send somebody to tomorrow. Yeah. That's why you need a professional, because even for us, when we can't keep up, how can the layman on the street, the patient who's sick and needs care now, you can't expect them to keep up on their own.
Yeah, so what would you say the biggest mistake people make, is every year?
Don't be afraid of change, because, oh, I've had this insurance for 20 years, and it's doing well for me, or it has done well for me in the past. That may be true, but is it going to do well for you in the future?
Yeah.
Just like sports. The team that went to the championship last year may not go this year, may not do that well this year. You got to keep reassessing.
You must be an Eagles fan.
Just a little bit.
All right, Dr. Sayasambat, P3 Medical Group, thank you so much for being with us today. And this Thursday, we are partnering with P3 Nevada for a Facebook Live event going on at 10:30. Just head over to our Facebook page, Las Vegas Now TV.